Welcome to Samba Samba. Enjoy the video.
You begin by confirming sterile tools and a clear view. Once your metal ear cleaner is wiped with 70% alcohol and dried, position a towel and a mirror. Tilt your head about 30 degrees away so gravity helps dislodge wax. Move the tip slowly. Do not push or jab. Apply minimal pressure and use short scraping arcs toward the opening. If you feel pain or resistance, stop immediately and reassess lighting and angle before continuing. You proceed by inserting the metal cleaner only a few millimeters. Aim for 3 to 5 mm from the canal entrance, because deeper risks injury. Once inserted, rotate the tip along the ear's curve and scoop outward, collecting softened wax rather than gouging. Make several gentle passes, wiping the tip on the towel between attempts. If wax is stubborn, apply a few drops of warm saline or mineral oil and wait 5 to 10 minutes. Remember, steady, controlled movements reduce trauma and improve results. You finish by gently wiping the canal area with a soft cloth and re-sterilizing the metal tip. Examine the ear for redness, bleeding, or persistent pain. If any occur, stop and seek medical advice. Do not continue trying to fix it yourself. Store the cleaner in a dry, protected case and inspect the tip for burrs before future use. If wax compacts or you feel pressure that won't subside, that troubleshooting tip. Pause and consult a physician.
Thanks for watching. Consider subscribing if we helped you.